So there were a couple of posters that looked at outcome measures, including CMAP, revised upper limb module, and electrical impedance in muscles. And these studies basically were looking at the later onset SMA patients to see how they were responding to treatment with Nusinersen. And what was generally observed was there was general stability across all these measures. One of the posters actually showed the revised upper limb module did show some slight improvement in some of the patients after being started on Nusinersen. But by and large, we're seeing mostly stability across all of these outcome measures. I think that what that means, though, is that patients who are being treated are achieving stability, which in many ways is also still a clinically meaningful outcome. So these tools, including CMAP, revised upper limb module, and electrical impedance myography, these are generally considered research tools to follow patients with SMA. In other words, we've not actually been doing these tests on patients in the past, unless we were enrolling patients in a research study to try to understand what the natural history of the disease is. It's not exactly clear what their role is in patients who are receiving treatment, and if it has any bearing on how we're going to manage them in the future. That being said, though, I think if people are interested in the course of patients who've been treated with Nusinersen, it can be helpful. However, these outcome measures really do require training. So CMAP requires somebody who actually is familiar with doing electrodiagnostic testing. Revised upper limb module, Hammersmith, these are things that actually require training as well, and typically are done by a physical therapist. And electrical impedance myography requires special equipment that most people do not have.